All right. It says we are live. Hello, everyone. My name is Julie Hirschberg, and I got somebody with me today. Yay! And I am the owner-founder of Reactive Therapy and Wellness here in the Los Angeles area. And we try to join you all live every week just to share a little bit about what we're learning, maybe what we're reading, and share it with the world. And today I'm super excited because I've got the most amazing Dr. Emily Schultz with us. This is your second day at Reactive. Yep. Is that right? Yes. So we just spent the day together basically, and I've been so excited to have Emily join our team. And I'm gonna let Emily introduce herself. And you've got fans on here. Emily has fans. She's the best. She is the best, and we are so excited that she's part of Reactive. But maybe you haven't met Emily. I know, Emily, we've done some live videos to talk about your involvement in Brain Bites and other things like that, but not as a part of our team. So you've got to share a little bit about who you are to our Instagram world.
Hello, everyone. I'm Emily. As Julie said, I met Julie 6 years ago. Yeah,
wow.
6 years ago. When I completed my residency here with USC and Rancho, to help learn and specialize in neuro, and have been a neuro nerd ever since. After residency, I moved down to Miami and worked at the University of Miami, serving as clinical faculty in our residency program there with Jackson and UM, and worked in the outpatient neuro world, just really falling more in love with this craft every day. And so life is crazy from Kansas, lived in California, Indiana, and Miami, and now back to California. So we have just moved back here, and I'm so excited to join the Reactive team, even though I feel like I've been distant team for the past few years.
Yeah, I think one of the things that has been so cool, and by the way, somebody asked, love your lives, what are we talking about today? Great question. I mean, first we wanted to introduce everybody to Emily, but Emily and I did kind of have a topic that we've been talking a lot about today, and just has been something that we're both really passionate about, which is lifelong health and wellness in a neurologic disorder or chronic illness. It can be so challenging, but it's part of what brought Emily here to Reactive, because this is something that we're so passionate about. So thank you for asking, we are going to chat about that, but we didn't want to do it without introducing Emily. And what has been so cool is Emily has been a part of our Brain Bites group. And if you're not familiar with that, it's a mentoring group and community of physical therapists, occupational therapists from all over the world who really have a passion for neurologic conditions, and particularly complex conditions, things that maybe are not taught in school. And Emily is one of those people with a little bit of extra passion. We've collaborated on cases of people with dystonia and functional neurologic disorders, ataxia, amongst many other neurologic disorders. So what's cool is, because Emily's been a part of our community, is kind of coming into Reactive. It's almost like you've been a distant part, like you said, a distant, East Coast version, doing Reactive, and being able to bring it to our team, which I'm so excited about. We were able to work with patients this afternoon, and it was so fun. It was so fun to work together, and that's something that we really value at Reactive, is that collaboration and working together. Let's bring in the East Coast experts to our team so that we can just brainstorm ideas. And one of the things I was going to say, we were working with somebody actually in this room, and And it was so nice to just have another set of eyes. And you were like, well, what if we actually like moved it out here? And we just kind of changed the base of support with somebody that were really trying to challenge their balance and their arm control and things like that. And I was like, oh yes, like just even those little things, I know they can seem really basic, but having another set of eyes is so nice. So I promised that we had a topic. So because somebody asked, like, what are you even doing? So the topic of wellness comes up a lot. I'm so fortunate to be a part of our national organization. We have a group that is advocating for health promotion wellness, particularly the accessibility of that, and then how we, as physical therapists, but I would say OTs as well, how we do that for people who may need accommodations, who may need accessibility for it. Maybe going to 24-hour fitness might actually make it worse. It might not be the best things. Or how do we modify what's happening at 24-hour fitness? And one of the things that's been a part of Reactive literally from the first 6 months is that we've had a program of wellness because we saw the need and there was nothing out there. There were not accessible yoga classes for people. And we had patients that would go to yoga and get worse. And we were like, yoga can be so therapeutic and helpful. How can we do this ourselves? So we've had that. So that means going on like 11 years that we've had a wellness program. And Emily, I'm curious, you've worked in various settings, right? And I know, from like your ending up here at Reactive. And by the way, Emily's our new wellness program director. So I knew that this was a passion of yours. And I'm kind of curious, why? Like, what are some of the things that you saw as needs in neurologic conditions, chronic health conditions for lifelong wellness?
Yeah, I feel like I've been passionate about wellness for my whole life too. I think just, being involved in sports and fitness and wellness, like activity and staying active and enjoying being active has been something that's been a high value for me. And I always felt like just even in exposure in PT school that this was something that the individuals with neurologic diagnoses didn't always have an opportunity to do. And I felt like that wasn't right. Like there should be ways to do this because it is so important. And so my love first started when I was in PT school. I was a co-founder of Acercise, which was a pro bono group exercise program that we have at the University of Evansville. And Caitlin on here was a director after me. So, cool. But that's really where it started. And after that, going into residency and working in big hospital systems and outpatient systems, I still just felt like, at the end of a plan of care or outside of our walls in our clinic, like there was so much more that needed to be done and it wasn't happening. And we didn't have places to tell people where to go, or people didn't even maybe feel empowered or confident enough to know that they could go. And so just seeing, how much evidence there is about the necessity of wellness, the necessity of intensive exercise, and on this regular basis, I think that we are not truly tapping into people's maximum potential if they're not getting rehab as well as wellness, and even more importantly, wellness, because that's more days of the week. Like that's a lifestyle. That's forever. That's the medicine. So I really was feeling like that was a bit of a void, something like I didn't have the opportunity to explore or pursue. And I felt like that was just something that I wanted to give to people so bad and help empower people to live well and take control in an element of their lives and their recovery and their management. And so having the opportunity to come here and help jump into your program and become wellness program director is so exciting. And I am just so excited to get started.
I know, we like jumped right into things today. I was like, what classes do you want to teach, Emily? And I think, some of the things that I love is wellness is a part of all of our lives, right? So this is not something that like, just because you have a condition, you need wellness. Like you said, this is something that you've lived forever. And now I know not everybody is like I wasn't an athlete like you. So, I enjoy being active. I enjoy running and I enjoy being outside. And I actually enjoy a little ball playing things that you do. But I was watching Emily today. We were playing a little soccer thing and I was like, clearly she knows how to handle a ball much better than I do. But I think sometimes even more for the folks who actually might not have a practice of a sport or, or even like a regular exercise routine, the people that are like, I hate exercise. I think even more, because I think sometimes you read the research and you go, well, aerobic exercise or high intensity exercise. And then you're talking to the person with MS. It's like, I don't have use of my legs. Or you're talking to the person post-concussion who's like, when my heart rate goes up, I'm passing out. And so some of those things that you might actually be able to normally access in, at a 24-hour fitness or in a group class of some way, actually might not fit for people. And so I think it's exploring ways to achieve something outside of rehab, because I think that's the other thing is like, no one wants to live in rehab forever. It's you want to have a practice of wellness in your everyday life. And I think you said like, that's every other day of the week, right? Like if you're coming to therapy a couple times a week, it's every other day. What are those practices? And exploring those, understanding what works for a person individually. And then something that we talked about today and some of our mission going forward is the social connection part. And so you're getting cheers for the Go Aces. This was a group-based program?
A pro bono student program. Yeah.
Oh, okay.
Yep. Back at University of Evansville. So we were Purple Aces.
The Purple Aces. I love that. I love that. But that's something that as we've started to do a few more in-person classes and even online, having that like community of support. I know you've been doing a ton of telehealth, but primarily one-on-one, right? Not group-based. But you have seen, I think, very firsthand, I know we all have in the healthcare world, of people really losing connection with other people. And that's something that from whether it's like a group-based class or a group support group. And one of the things that we're looking to really build is peer support for people. I can't even tell you how many people have asked us about that, when like maybe they're a person with FND and just being able to be in a positive support community with other people. It can be so helpful. Outside of the rehab setting. So those are some of the like areas that we really like see a need and an opportunity to grow from a wellness perspective.
Yeah, and I feel like with the social support too, in these wellness groups, these are people who have committed to wanting to be well and committed to these steps of their recovery. And recovery looks different for every single person, but it always feels better when there's people there cheering you on, or, people there to have a shoulder when something's hard. And those are really unique opportunities that can come up in these types of settings. And I think that that's a beautiful thing about, having group classes and group settings. And then doing so with staff and, people who are instructing the classes who really know, these conditions and understand some of the challenges that might be there and can really help to modify and adapt and empathize and encourage and really facilitate people to be at their best. And I think that's what makes these programs here at Reactive so amazing and so exciting.
Something else. Well, I mean, very cool that we also, I mean, we have neurologic personal trainers leading classes. We have PTs leading our classes, OTs, and I just think that extra level of expertise, like you said, like to be able to modify, to be able to respond is so helpful. And another thing that's really cool, I know a lot of people who join our live videos, by the way, thank you, hello. They're from all over the country, maybe even all over the world, and literally every single day I'll get a direct message that says like, do you see people in India? Do you see people, today it was Texas, Indiana, like Tennessee, North Carolina. And as therapists, PT, OT, psych, we can actually only treat people according to our licenses. So we're limited in some of our therapy services. We can't. Now you can actually see people in Florida.
Yep.
Because you have a Florida license. But I can't. I only have a California license. So what's really neat about wellness is that it's without borders. It's without limits. And so our classes, our online classes, obviously in person would be hard to get to, but online classes and online personal training and online yoga therapy available to everybody everywhere. So I will often hear from other therapists, hey, like, can you tell me about this class? I think this might be, actually, this was recently, this might be really helpful for the person I'm seeing post-concussion. Tell me about your autonomic class. Well, it turns out we have an autonomic class. It's called Recenter, and it's led by a occupational therapy assistant, the wonderful Liz, and then that's open to anybody. Now, is that a rehab program? No, like we're not claiming that, but is it wellness that is adapted and modified for neurologic and chronic conditions, led by people who understand neurologic and chronic conditions? Yes. So that is something that has grown a lot for us over the pandemic, but just beyond, as people have really reached out wanting resources. There's not a lot out there led by professionals who understand these conditions so that they can adapt and modify to people. So one of the reasons we brought Emily on is because this program has just like really exploded, and it's exciting, and we're really excited to have you at the lead to kind of take that to the next levels, frankly, so we can increase accessibility for people, because we've already got it. Let's help get it to those folks that need it. So on that note, actually, if you are, first of all, on our email list. So I actually am going to include one of the articles. We talked about this. It's a resource from the Health Promotion and Wellness Committee of the APTA. Our fearless leader herself and several other authors put together a really great decision-making tree and talked about the role of wellness and how to do this as a therapist. So this has been one of the greatest resources that I've seen just published this year. I'm going to put that in our newsletter this week to kind of tie in our wellness theme. So if you're not on our newsletter, join the newsletter. You can join at reactiveeducation.com if you're a healthcare provider, or reactivept.com if you are a person with a neurologic condition. And we'll send out the videos, we'll send out these resources, and I'll send out some links if you're interested in trying some of this program that we're talking about. Maybe you want to try our autonomic class. Maybe you want to try some of our movement classes or boxing classes or a restorative yoga class led by our awesome team, who you'll get to meet all of them, Emily. I know you've met some, and they're just really, truly amazing people. So I'll send out links to all that. But of course, you can send me a message. I get messages all the time. I try to respond to them and send out links if you are interested, or just answer questions about things that you might have with our wellness program. And soon enough, it'll be Emily answering all those questions for you, which is awesome. So I want to thank you all for coming and joining us as we talk about wellness and neuro. And thanks to Emily for being part of our team.
Thank you.
We're super excited. Oh, one last note, and I'll put this in our newsletter too, because I know we talked about brain bites. I wanted to let you all know, if you're a healthcare provider like Emily, who was really wanting a community and mentorship with some of the complex neurologic disorders like functional neurologic disorders and CRPS and dystonia and 3PD and things like that. Our community is actually going to open our doors next month in September, which is pretty exciting. We only do it twice a year, so I know I get a lot of people like, when is it opening? When can I come? I have questions on a patient with FND. Can you help me? That is exactly what we do. And Emily knows because she comes with her patients. And well, now you can come and you're here, but she come from Miami with her patients and say, can you help me with this? We have live sessions every month, and then we have an online community to ask questions. And it's certainly like it is honestly one of my favorite things to do, to be connected with people like you. And when we can't be connected in person like we can now, but to have that connection with other therapists, it really has been just a great community. We're 2 years in, 2.5 years. So it just keeps growing and growing. I think because there's a lot of therapists who are seeing some of these complexities. We didn't do this in school.
No.
We didn't do it in residency, right? Like, you could be a neuro specialist and have never learned these things. Yeah. So, of course, we're trying to change that. I'm so excited. I get to do F&D this year in the third year at the USC DPT program. So it's coming. But anyway, if you're across the country and looking for that kind of community and mentorship, you can get on our wait list for Brain Bites. So you could go to reactiveeducation.com/Brain Bites, get on the wait list, and do get on the wait list, by the way, because we're going to open it up early for you, and there's a big discount. So get on that wait list if this is something you've been waiting for, and then, you know, maybe someday you'll move out to California too. Just like Emily. And we'll just keep growing Reactive together with our Brain Bites crew. So thanks so much again for joining us tonight. And welcome, Emily. Thank you.
Thank you.
We'll see you all soon. Thanks so much.